this is probably the same patient. Can we remove an abscess? So this is probably the same patient a few weeks before. Can we? Would we? We tend not to get involved in abscesses. Is the answer to that? So I guess any surgeon, I guess, could have a go at an abscess. An abscess usually just needs draining, so kind of lancing, putting a knife in and letting the evil humours out. Sometimes there's a cavity and you pack the cavity and things like that, depending on where the abscess was and how bad the abscess was. But it's usually a general surgeon. That'd be, if it's going to be a surgeon, I mean, often antibiotics and what have you. So in terms of removing an abscess, you don't actually remove an abscess, you kind of treat an abscess by letting the evil badness out. But you don't do kind of search. So let's say it's a cyst that's formed an abscess. You wouldn't do surgery to remove the cyst while it's an abscess for two reasons. First of all, the local anesthetic doesn't work and it's a nightmare. Second reason, everything's inflamed. The cyst wall is like soft, wet paper. There's no good planes. The local doesn't work. You just don't do it. If you made a cut to get the cyst out, you stitched it up, that cut will get infected. So it's completely not. Now is not the time to remove the abscess. So you don't, or the cyst, you don't remove a cyst when it's in an abscess. So when it's an abscess, when you've got an infection, we wouldn't get involved. We'd normally say GP, who might refer you to A&E and general surgery or whatever, depending on how bad it is, who might lance it, might give you antibiotics or whatever. When the abscess settles, if there is a thing, i.e. a cyst or something, then yes, that's when we would step in and remove that cyst or that whatever it was that got infected. But so we don't get involved in the abscess stage. We step in and take the glory once the abscess has settled. So yeah, so can we remove? So yeah, as I say, you don't really remove abscesses. You just treat abscesses. You drain the abscess. You don't do definitive treatment when something's infected. You do the minimum amount of surgery because you don't want to give extra scars and stuff because they'll get infected. So you normally just open it and leave it open. Kind of normal.